today I want to talk a little bit about training load, sleep, and injury. Hopefully you guys can see my screen okay. And the goal is really to think about load management and sleep as we're returning our athletes from probably the greatest trough in their training history back to full speed sports. So we'll go over some overuse injury background, talk about training load and injury, then do a little bit on sleep and a quick review. So starting with what an overuse injury is. So this is any injury that is caused by repetitive submaximal loading. So this is not a big trauma that would cause a fracture, but submaximal loading of our musculoskeletal system when rest is not adequate to allow for structural adaptation to take place. So it's a nice interplay of load and then recovery. If we see this graphically displayed, what happens is you have some kind of sport participation or training activity that repetitively loads our musculoskeletal system and creates microtrauma. Now, the two roads divided in a wood here are relative to recovery and the volume of that load. So with sufficient recovery between those loading exposures, you're going to get tissue adaptation and then improvements in performance. With excessive stress or inadequate recovery, you're going to overwhelm the ability for the body to recover from that load, and then you're going to end up with weakened and damaged structures. This is graphically another way to think about load and adaptation. And so what we'll see here on this red curve is the application of a load. So for example, 10 push-ups. So you do 10 push-ups, they get a little bit harder each time until you reach number 10. You give yourself adequate time to recovery, and then the next time you go and try and do 10 push-ups, they feel a little bit easier to do. And then you have excellent recovery, and so we're gradually increasing the capacity and the ability to perform a task. This is a poor example of what would happen. So if you have training load and maladaptation, you're going to apply that same load, but with inadequate recovery, then when you repeat that load, you're going to have progressive decrements in performance. So rather than getting stronger, it's easier to perform the task, it becomes harder and harder. And this is, again, that interplay of either too much load or insufficient recovery. When it comes specific to overuse injuries in soccer, we can learn some things from the research recently published in BJSM. So this was a study where they looked at 733 youth soccer players followed over a typical 20-week season. And they found that 46.8% of athletes in that cohort reported an injury during that time. Girls had a higher likelihood of having knee problems, boys more likely to have heel problems, and in general, those overuse injuries increased with age, which is very interesting. So next we want to think about risk factors. What are predisposing our athletes to these overuse type injuries as they're returning to play? And there are a number of intrinsic factors we want to be aware of, but may not necessarily be something we can control. And then there are these extrinsic risk factors. And this is where I want us to really focus our attention today is what can we be doing to help minimize that inherent risk? So the first is lack of preseason preparation, and I think in the COVID pandemic, this is going to be a big issue for us. I know that as we have collegiate sports returning to campus, our athletes are in the worst shape they've been in since middle school. And so we want to make sure that we're having a nice gradual ramp up to maintain and regain that baseline conditioning needed for sport. Second is looking specifically at workload. And back in 2010, we published that 16 hours per week was the maximum load on any youth athlete. And we really found that this is actually can be even more specialized by age. And we're seeing that you should not be training more hours than your age. So for a 10-year-old, that's a maximum of 10 hours of their sport per week. For a 17-year-old, that's 17 hours per week. Specific to baseball, there's something about 100 innings that seems to be a magic number per year. Next is year-round participation. And so we know that athletes in warmer climates like Florida and Texas and California, we have the ability to train year-round. And so there's a 42% increased risk of injury in those who are training year-round as opposed to taking a season off. And then lastly is training and competition schedules. Again, in Southern California, we're a hotbed for youth sports. And so we have club leagues and youth leagues and school leagues. And so all of these programs stacked on top of each other can really compound these overuse injuries. So next I want to talk a little bit about training load and injury. And this is a very hot topic in the world of sports medicine right now. But first we need to define training load, and the way that we think of load is in two different categories. First is what's called an external training load. This is work performed in a very objective way. So for example, running a mile, you're external load is 1 mile. Secondarily, there is internal training load, and this is what the effect that load has on the individual athlete. So while 1 mile is a consistent external load, the stress that places on a 10-year-old versus a 17-year-old or a marathon runner versus a shot putter is going to be very different. And so that internal training load is how that standard external load affects the individual athlete. And we have a number of different ways of monitoring this. Heart rate is the most commonly used one. So next, when we're thinking about training load, we also want to monitor different sports differently. So for example, a team sport, which has lots of different direction changes, we want to use GPS and accelerometry. We also use a metric called rating of perceived exertion, or RPE. So this is simply asking the athlete, how hard was that physical exertion for you? With endurance sports like marathon running or cross country, we want to look at these differently. So we want to look at training time and distance. RPE can also be helpful, and then heart rate. And lastly, when we're looking at the young athlete, we need to think even a little bit differently about how we're monitoring training load. So specifically asking them to have training diaries or looking at load and then symptoms they may have after that training exercise. So are you sore? Are you having any pain? When we quantify load, we want to ask them how hard it was, but also the total training time, specifically because asking a young athlete how vigorous or challenging a workout was is pretty unreliable at young ages. And then lastly, and most importantly, I would argue, is quality of life. So we also want to be asking about psychological metrics, like how is your mood after training, and screening for burnout in these young youth sport athletes. So next, now that we've understood how to quantify our workload, how can we apply that to injury? And so we've developed this workload injury model. Dr. Gabbett out of Australia has done a lot of research here. And he found that the cumulative amount of stress placed on an individual for multiple training sessions and games over time is how we want to aggregate a workload. We know then that rapid spikes in this workload are associated with injury in soccer and rugby, as well as a number of other field sports. And so this is the model that Dr. Gabbett developed, where he looked at how quickly we can change a load week over week. So he theorized that a change in the acute workload, so how much training you're doing in a single week relative to how much you've been doing in a longer period, say over a month, will help predict injury. And was able to prove out this point in a number of different sports. And so the takeaway here is that we want to live in the sweet spot. So what is this sweet spot? The sweet spot means we don't want to increase a workload week over week more than 20% per week. If you're increasing that workload more than 20%, you start heading into this danger zone. So that's that rapid spike in workload that's going to cause injury. On the flip side, we also don't want to decrease workload too drastically. And this happened back in March for many of us with athletes getting ready for season, where everyone was sent home and told to shelter in place. And so we had a rapid fall off in the amount of training that they were doing as well. And this is because consistent training is also protective. So we know that exposure to load allows the body to tolerate similar subsequent loads. That's the point of training. And that training will develop the physical qualities, for example, strength or aerobic conditioning, that you need to reduce injury risk. So that's why there is this theoretical sweet spot. We don't want to increase training too much, but we also don't want to hit the brakes too quickly as well. So the key takeaways from Dr. Gabbett's research are that spikes in training load can cause injury, but so can troughs. So as we're thinking about our training load in athletes, we want to be monitoring this over time. And so this is an example of looking at an endurance athlete with their running mileage, and we can see some significant peaks and troughs that we would ideally have wanted to smooth out. So here we've got a nice steep fall off and then a rapid increase in training, same thing to a smaller degree here, and then a much larger one here. And those peaks and troughs really terrify sports medicine physicians like myself, knowing this data. So my advice to coaches is, as you're ramping up at the beginning of season or cooling down at the end of season, try and smooth out those peaks and troughs to reduce injury. I also want to show you some examples in soccer players. So here they're talking about elite, quote, footballers. This is Europe's way of saying soccer players. So they followed 32 athletes over 2 seasons, and they looked at workload data and injury. And they compared the injured and non-injured players in terms of their GPS numbers and their accelerometry. So what did that workload look like in a field sport? There were 2 key findings. Higher cumulative and acute workloads were associated with an increased risk of injury. And on the flip side, progressive increases in workload built up a player's tolerance to higher training loads and reduced their risk of injury. So exactly what Gabbett had theorized is coming true, or proving true in this youth soccer population. The second study looked at youth female athletes, and they interestingly also added in some quality of life metrics. So they monitored 75 athletes over a 20-week season. They looked at mood, fatigue, stress, soreness, sleep quality, and sleep hours. They also looked at training load, injuries, and illness, which is really important in our young athletes. So there were three key takeaways from this study. One, they found that higher training loads were seen on days with injuries. They saw that higher chronic training loads were predictors of illness, so not injury, but getting colds and flus and other things. And that risk factors for injury included higher daily training loads, higher prior day training load, and a worse daily mood. So this is the first time we've now shown that mood can affect injury rates. So some practical takeaways for coaches and parents. First and foremost, spikes in training load are associated with increased risk of injury. Second, high chronic training loads, assuming that you gradually build up to them, can actually protect against injury, but over an extended period of time can increase risk of illness. And lastly, mood and burnout are equally as important as we're monitoring young athletes and we're trying to reduce injury and illnesses. So next I want to transition over to sleep and injury, and we have some really fun data in this place as well. So first, we want to talk about how are we going to measure sleep in our athletes. And there are two ways to think of this. We can think about sleep quantity, just total number of hours you're asleep. And then we can also think about sleep quality, which is how rested do you feel after said amount of sleep. And the most important question that I like to ask is, well, which one matters? We don't want to monitor everything. So if we had to pick one, which we'd be measuring, and this study really nicely showed us that sleep quality was better associated with health and mood states than sleep quantity. So if you have to pick one, let's worry about quality. That's not to say that quantity is irrelevant. So I briefly want to talk about how adolescents in general are doing when it comes to sleep. So this is a nice study out of Norway. They followed 10,000 adolescents aged 16 to 18, and they found that in this population, on average, there was a 2-hour sleep deficit per week. Girls took longer to fall asleep and had higher rates of insomnia than boys. Boys tended to go to bed later and have larger discrepancies in their sleep between weekdays and weekends. And in general, 18% of this population reported insomnia. So we did a similar study in the US looking at a 20-year window following adolescent students. And overall, we found that during that 20-year period, sleep generally declined. So we were sleeping less in 2012 than we were in 1991 as a whole. And that girls were less likely to report getting 7 hours of sleep compared to boys. This is what that data looks like plotted over age groups and time. So this top bar, this nice orange line here, is showing you what it looked like in 1991, and then fast forward to 2011 and 12, and you can see that those numbers decreased overall. And also, 12-year-olds are doing a much better at sleeping than 19-year-olds. So as we age and as our population ages, we do a poorer job of sleeping. So we know that adolescents are going to be behind the 8 ball to begin with. This is a combination of stressful high school and advanced placement classes and tons of sports and extracurricular activities. So my plea to young athletes is know that sleep is going to affect your performance. So if excelling on a soccer field is a high priority for you, you need to put in the time and get your sleep. Sleep causes a number of problems that decrease our performance. So number one, it causes cognitive lapses. So we can have these micro sleeps. Our brain just turns itself off for a split second and turns right back on. We have general cortical de-arousal. That means the cortex, the really important part of our brain that's responsible for our motor function and our cognition, is not working as well as it should. We have increased sleep-wake instability. So in addition to those micro sleeps, you will actually fall asleep if you're sitting on the sideline quietly for too long. And then we have reduced task motivation. So we know that training is important for success in sports, and we're just not interested in doing that when we're sleep deprived. Specifically looking at sports, we also found that there's an increased risk in injury relative to sleep deprivation. So this is a really nice study that was done at Harvard Westlake right here in Los Angeles, where they surveyed 112 adolescent athletes, and they correlated those responses with a review of their school injury records. And this particular study found that sleeping less than 8 hours per night led to a doubling of your risk of injury. Here's another study looking specifically at elite athletes. So they surveyed 340 adolescent athletes. They found that 19% of athletes did not meet their sleep recommendations. But in the subset of athletes that were, so these are athletes sleeping more than 8 hours per night, they reduced their risk of injury by 61%. So now we got a study showing sleep deprivation increases your risk, and sleep extension is going to reduce that risk. But for those of you who are not worried about injury, you only care about performance. This is also going to reduce your performance. So this was a study looking at 19 soccer players. They compared two groups. They looked at habitual sleep, meaning just do your normal sleep schedule, and then they deprived them of sleep for 24 hours. I'm not sure how they got this study done. I don't think we're allowed to do this in the States, but they did. And they found that sleep deprivation reduced their performance on various kicking tests, an essential and important skill for soccer players. And lastly, my last plea for increasing sleep is that this will affect your academic performance as well. So this is a really nice study out of University of Minnesota, looking at undergraduate students, so not exactly high school, but pretty close in age. And they surveyed them for sleep quality and sleep deprivation. And then they correlated that data with their GPA. And they found that students that were sleeping more hours per night had significantly higher GPAs, and that students that were sleeping less than 5 hours per night had significantly lower GPAs. So here we know that sleep is going to improve your GPA, it's going to improve your sports performance, and it's going to reduce your risk of injury. So lastly, takeaways for parents and coaches and students is how can we improve our sleep? So I just convinced you that sleep's important. Now what? And so I go to the National Sleep Foundation in terms of our recommendations for what we call sleep hygiene. So just like we take care of our teeth by brushing our teeth and flossing, we need to optimize and enhance our sleep. And so first and foremost, you really want to stick to a sleep schedule. So ideally you have the same bedtime, same wake up time every day of the week, weekdays and weekends. Second, our brains need to wind down before we go to sleep. So having a nice relaxing bedtime ritual is key. And as I talk to my athletes at UCLA, their idea of a wind down ritual is like watching TV or playing video games or messing around with their friends. That's not a good plan. Okay. So you want something calming, boring, that's going to help your brain unwind and get ready for sleep. For the subset of people who have trouble falling asleep, you want to stay away from naps. So I could give you a whole talk on the benefit of naps, but if falling asleep is an issue for you, you got to stop napping, especially in the afternoon. Number 4, exercise daily. This is really easy for our athletes because this is a part of what we do, but exercise really helps the system wind down at the end of the day. You want to keep that exercise earlier in the day as possible, but exercising daily is beneficial. Next, you want to design your sleep environment to establish the conditions you need for sleep, i.e. it should be quiet, dark, and without distraction. So TV on, bright lights, and a cell phone next to your bed is not a good plan. Okay, so you want blackout shades, you want it nice and quiet in there, and you want to eliminate any distractions. Next, you want to sleep on a comfortable mattress. People ask how often should you change your mattress, and the answer is about every 10 years. You want to avoid heavy meals and caffeine in the evening. So I tell my athletes no caffeine past noon. And when it comes to meals, you want to eat ideally sometime around 6, 7 p.m. at the latest, so that your body has time to digest that meal before you go into bed. And lastly, with the wind down, your body needs time to shift into sleep mode. So that last hour before bedtime, again, going back to that relaxing bedtime ritual, you need to protect that last hour before bed and really try and keep it stimulus free. Cell phones, computers, TVs are not stimulus free. And so you really want to protect that last hour as much as you can. And with that, I will turn it over for questions.
So we're actually going to take questions at the end once
Take them at the end.
once
Sorry, Toby.
once we are done with Jennifer's presentation. So next we have Dr. Jennifer Beck, and she is a sports medicine physician and orthopedic surgeon at UCLA Health and OIC. And today she's going to be talking about injury prevention returning to play.
Okay, great. Well, thank you everyone for coming. Let me make sure. Hopefully you've got the correct slides up there. So thank you. I think this is a really important topic for, both Dr. Goldman and myself. As I know right now, we're seeing a little bit lower levels of injuries in our clinic, but I think we're both are quite fearful of things opening up and kind of what's happening. And we'd love to keep all of our kids safe and on the field and having fun. So I'm going to go through and kind of talk about particularly musculoskeletal injuries and what we can do to prevent them. So I'm going to go through a couple different things, just kind of what has been the current state of youth sports. I'm going to go over just a couple different types of terminology that get confusing for people and make sure that we're clear on the words that we're using. Give some just tips to the coaches and the parents out there about when you should be seeking medical care. And then kind of lastly, wrap it all up of how can we stop these injuries from happening. You're going to notice very quickly a common theme of some great research that's happened in youth sports that both Dr. Goldman and I really want to get the message out about these hours per week of training. So when I talk about things, and I think this applies to a lot about, what Dr. Goldman just talked about, is there's really this kind of Goldilocks principle of we want to get it just right. Trying to figure it out what that just right is can be difficult. And so hopefully we're going to give you some information in this talk as well about how we can get it just right. We notice that, things happen when you've got kind of this bell-shaped curve of too much, too little, and just right. And anybody who was involved in youth sports, pre-COVID knew that everything that was coming out was about overuse injuries, was about overtraining, that we were just doing too much, burnouts, injuries, multiple leagues at the same time, year round. And we knew that that was taking us on a path to injury, burnout, which was not necessarily the right path to be going for youth sports. Then all of a sudden COVID hit, and now all of a sudden we've got kids doing too little. So everyone's just been hanging out, doing their social isolation, staying at home, not having access to their gyms, their training. That causes kind of its own set of issues, as Dr. Goldman mentioned. And so I think our hope for the future and what we're trying to relay to all of the coaches, parents, participants out there is that we can get it just right. And that there is this middle ground of making sure that we have fun, that all of the benefits that we know there for youth sports, including the physiologic, the physical and mental benefits, that we get all of those, but we also keep our kids safe so that it's not just this season, this year, this high school season, but that these kids are participating in sports for a lifetime, which is really in the end the goal for everything. So anybody who's been following the NFL and what happened with the NFL knows that there's this dramatic increase in injuries that have happened as the players went back. This is an article back right after NFL started, and the dramatic number of ACL tears, injuries that were happening on the field, acute injuries. And that's something that we are hoping in youth sports to avoid happening. There's a lot of different reasons that this has happened in the NFL. A lot of people are blaming just the short preseasons, lack of preparation, lack of off season. We know at the beginning of football seasons in general, we see an increased number of injuries, but this year has been above and beyond what we've seen in past years. And we'd like to take what they've done in the NFL and hopefully learn from it so that our kids don't have the same fate that these NFL players had. So just to kind of take a step back and talk about terminology for a quick second. So what is acute? What is chronic? So acute injuries is something that happened at one moment in time, is that they knew something happened. There was a plant, a twist, a fall, something specific, going up for a header, crashing into people. There's something that happened at one specific time. It was a change that they were doing fine, and now they're not. The chronic injuries, the ones Dr. Goldman really are referring to, are things that have been worsening over time, kind of injuries just slowly developing. Maybe it can be hard to pinpoint when they started, but just worsening over time and gradually developing. So that's something that we really try and use in helping to differentiate between our different injuries. It is so that we have those definitions. The sprain versus the strain is something that we really also talk about as well. So we've got sprains are ligament injuries. So they're injuries when it comes to tissues that connect to bones. And that's something that we talk about in contrasting to a strain. So we've got a tissue that is a tendon that's connecting muscles and bones as opposed to the ligaments. Oftentimes they get kind of used interchangeably, but that's something that we do differentiate between the two so that we have what a sprain is more of a ligament injury, something that they've twisted it, versus a tendon injury, which is more of a strain, which is the muscle connecting to the bone. I just got a message. Is there an issue seeing my slides on this?
Yes.
Okay. Let me see if I can change how that is. I've got a double screen here, so let me see if I can figure out how to do this. That made a difference?
You need to share your screen
Oops,
again.
sorry. Hold on.
Perfect.
Is that better?
Yes.
Okay, sorry about that. So just to go back to kind of the examples of, acute injuries, again, these are the sudden things that happen on the field injuries. These are the more devastating ones that myself as a surgeon typically is more involved in, and we hate to see happen. And this is really what we've been seeing, the more dramatic increase in the NFL players. So for the coaches and the parents out there, things to really be concerned if you've got a player, that something has happened to them. Is there something, an immediate swelling, or something's clearly out of place? So immediate swelling to me can even happen within 30, 45 minutes, an hour, something that if they were in the middle of a practice or in the middle of a game, that they then sit out for, and then all of a sudden they have the swelling that develops pretty rapidly. I think deformities are pretty obvious, is that clearly something is wrong, something's out of place. I think those ones are a little bit more clear. One of the simple and easy things is just kind of pressing over the different bones and pressing along the bones and seeing, is there specific pain along the bones? It's not always a joint that gets injured, but it could be something in the middle, in between the ankle and the knee. And so just kind of pressing along there. And if any child ever has an injury they've sustained either on the field during practice, and they've got pain over a bone, that's something that we would want to know about pretty quickly. Similarly, how much can they bend and straighten their joints? Is it their knee, their ankle? Is it something that they cannot do it at all, or that maybe it just hurts a little bit at the beginning or the end, and that they're gradually able to do over, a few minutes or a few repetitions? Can they fully move that knee joint, that ankle joint? And can they put any sort of weight on the leg? Is there pain, but they're able to do it and they can kind of limp off? Or is there absolutely no way, no how that they can put any sort of pain, any sort of weight on their leg? So, it's hard because, in orthopedic surgery, obviously, we've got a lot of different diagnoses that happen out there. And a lot of times just these bucket lists of, oh, it's just a knee sprain. Oh, it's just something. Those are something just to think about, is there are different things that can happen. And we really work with our sports medicine, non-operative, as well as our pediatrics colleagues that are going to see a lot of these patients, and saying, well, it's not just a vague knee pain, is that what we really get concerned about are things like the ACL tears that we were seeing in the NFL, other ligament tears. You also have this tissue called your meniscus, which is a cushion between the two bones that we can get injuries to. Kneecap dislocations, and then there's just growth plate injuries. These kids are still growing, and their growth plates are a particular location that they can have injuries to and are particularly susceptible to, as well as numerous different breaks and fractures, that are around their knees. These are all things that we worry about, that if you've got these immediate swellings, immediate bruisings, things that we'd want to know about sooner than later. So just as kind of a general overview, for the parents and coaches out there of, when to consider an ER urgent care visit versus something that maybe could wait a day or two. Here's just kind of some general guidelines. As we talked about, if something is out of place or something is clearly out of angle, the joint just definitely is not looking right, obviously we'd want to see that in the emergency room right away. If there's large cuts or breaks in the skin, that's something we would want to know about, particularly if they are over a joint. If the child's unable to put any sort of weight on their leg or unable to move their joint, that they're not willing to do it, no way, no how. If they have that development of a large amount of swelling over a short amount of time, so over that, 30, 60 minutes after their injury, or if they just have an intolerable pain, that something is clearly not right and the child's telling you that via their pain. Sometimes, whether the difference of trying to take them to the emergency room that night, or getting an appointment with us in clinic the next day or the day after, which, we're very fortunate at OIC that we've got providers in our clinics almost every day of the week. And so getting someone into clinic can be very rapid. But times to consider that is if it's just pain at the very ends, they can't fully straighten it or fully bend it, but they can do a majority of their motion. If they've had pain that then kind of subsided that day, but comes back and lasts the next couple of days, if they've got pain that requires round the clock, Motrin, Tylenol, anything like that, if swelling that not happened in the first hour, but maybe over the next couple of days, that'd be something that we want to see in clinic pretty quickly, or swelling that comes up and lasts more than a couple of days. We all know that sometimes we get these little swellings, they come up and go away by the next morning. Those I'm not quite as concerned about, but swelling that lasts a couple of days, those are things that I'd want to see that in clinic. So Dr. Goldman did a great job kind of talking about lots of different options of these overuse injuries, which we call more the chronic pains or after practice pains, that these are ones that usually kids are able to get through their practices, but they notice just afterwards, or maybe the next morning that they wake up with the pain. These are ones where training load is really important to try and reduce all of these. So for these really kind of when to have these addressed by someone in sports medicine, it's very rare that this is something that needs an ER urgent care visit, because this is something that's been developing over time. But reasons we'd want to see these patients is if the pain is worsening, if it's continued past a few weeks despite trying to change their activity schedule, if they've been trying to change maybe their sleep habits, they've been taking some Motrin, maybe they've been just resting a little bit. If it continues despite that, then we'd want to see them. If they are starting to develop other symptoms, so now not only is it some achy pain, but they also have swelling, they also have feelings that their joints are moving or shifting. Or if the kid's taking themselves out, that's actually a pretty strong indicator that that's something that should be seen by someone in sports medicine, because kids will really want to play at all odds despite everything. And if they're taking themselves out, that's something that we'd want to be concerned about and should be seeing them for. Something I get a lot of questions about, particularly as a surgeon, is popping knees and joints, which is actually very, very common, not necessarily an injury. There's lots of kids who can just pop and crack. I think the big thing to know is that if it's painless, something that they can do very easily, kind of as a party trick, that popping and cracking, not so concerning to me. But it's when it's painful or that it's associated with swelling, that's something that I think should be seen by someone in sports medicine within the next couple of days, to make sure that it's not some of these other diagnoses about meniscus tears or kneecap subluxations or movement. So those are kind of things that we would be worried about, is if there's pain associated with the popping, clicking, or swelling that's associated with as well. But kids just being able to kind of reproducibly pop and click their joints, very, very common, not something we typically worry too much about. So you have your kids getting back into your sports, and we know injuries unfortunately are part of sports participation. So what can we do to prevent this? And I think going into seasons, as you're looking at your children, your players, all your athletes, is what kind of risk factors do they have for injuries in the first place? So, a couple things that are pretty easy, just to think about is what is their age? We know gender has something to play with it, with females and males having different types of injuries. What sport they're going back to. We know female soccer players have a very high injury occurrence. What is the participation level and intensity before and after going, this break that we've had? And then also getting a quick, just little survey of your athletes that you're taking care of or that you're coaching, is what, do they have any injuries in their last season? Have they had any surgeries in this time off? Because there have been a fair amount of patients who've taken advantage of this time off to take care of some of their aches and pains. And so just checking in with them about, was there anything nagging them at the end of their last season before COVID hitting, and has there been any changes? Did they have any surgeries or any other treatment as this time and this break have happened? Some other considerations is, kids are kids and they're going to grow, and over a 6-month period of time, there can be a lot of physical changes that happen to them. And that's something that's naturally occurring as they grow and mature, but there's also been this great decrease in training that's also changed, I think, a lot of kids from their body habitus in that respect, not just the kids, but us as adults as well. What's their training actually been like? Has this been a child who has absolutely sat on the couch and done nothing for the last 6 months? Or has this been a kid who's been kicking a soccer ball over and over and over again in their backyard? Some also understanding what their diversification in their sport has been, and what they were beforehand, what they were during this COVID period, and then what they're trying to get back to afterwards. It's also very important to kind of consider. Again, I mentioned those previous injuries and other surgeries, making sure that you've addressed those, because I think that's a piece that definitely could be missing that's easily addressed. And then what is their overall biomechanics? Is there something, how are they running? How have they been training? What do their kind of legs look like? I think that's something that's really important and pretty easy to take a look at as well. And then as Dr. Goldman hinted and mentioned a couple times, is really the psychological mental proportions of injuries and injury prevention. I think we're just starting to understand, and it's something that's a very easy check-in. I'll give you a couple questions that you can just ask your athletes and your kids about, hopefully trying to assess their mental preparedness for getting back into sports. So as I kind of mentioned, kids go through physical changes, and I wanted to just put this growth chart up there. It depends on what kind of age you're going to be coaching. Obviously, kids that are in that pre-pubertal, 10 to 14-year-old age range for girls, and a little bit more 12 to 16-year-old for boys, that's when they're really going through their maximum height changes, going through their pubertal height growth spurts. The younger kids, a little bit more in elementary school, a little bit more slow and steady growth. But you'd be amazed to see in this last 6 months, if you haven't seen your kids, your athletes, your players, the dramatic changes in height that they will go through. And that's something that could affect their injury risk in regards to what their tendons have been doing and what kind of stretching they're doing. Have they had tendon tightening over this time? But also just body awareness, those biomechanics, their proportions of understanding where their toes, their fingers are, where they are in space. Weight is an interesting thing, is we're starting to get, lots of studies out about, weight gains and weight losses, depending on body habitus of kids naturally. We've all been enjoying our banana breads and our cupcakes and our cookies and our sourdoughs, over this time. But there's some kids who may have been more muscular and lean and who have actually lost some weight because they've lost that muscle mass. And so doing a quick check-in about what has changed in not only these kids' heights, but also body habitus, is something that can give you some indicators of, okay, where have they been in their training? What are there some things that I just need to be thinking about and more prepared to address? So during COVID, there's been a couple different types of kids. I think, a lot of us, unfortunately, are on that too little side of exercise with lots of video games, but there's also been some kids who've been out there doing the same thing over and over and over again, kicking that soccer ball because it's the only thing they can do, throwing that baseball because it's the only thing they can do. And we worry about both of these kids because some of them are already a little bit overtrained, and then obviously these other kids who are undertrained. And we want that Goldilocks just right in the middle. So what are some things as coaches that you can potentially think about? I think this, I have the website on the bottom of this slide. It's probably one of the most important things that I talk about when I talk with my patients. It's a very simple thing to do, and especially, with soccer, with lower extremity injuries. And it's a very good starting ground, is we have online this dynamic injury prevention program. It's something that you can go onto this website on ortho-institute.org and just search in our keyword search box for this dynamic injury prevention program, and a PDF is going to come up. And it's very straightforward, very easy, but this is the #1 thing that will help us prevent lower extremity injuries. And our data is really all in our ACL tears, which is especially for our young soccer players, something we worry about a lot. This is the #1 thing that can be done to prevent those injuries. What this is it's really just about 10 or 15 minutes, doesn't really require anything besides, a field and some space, can be done in a very social distanced manner, very easy to do. And there's really 5 different sections to it that you'll see it's broken into. There's a basic warm up that happens. There's some strengthening maneuvers that are there. There's some jumping maneuvers that are there. There's some more running, agility, high kicks, knee ups type, running type movements, and then an ending with some stretching. And this 10 or 15 minutes, it helps warm up all of your muscles, helps engage your muscles, and helps get your brain and your body connected to doing these movements. When I have, athletes asking me what they can do as a starting point, if you've got kids who haven't been doing much, over this last 6 months, this is a great place to start because it's very easy. Everyone can do it. And really moving forward, I would advocate that anybody who's coaching any sort of soccer team should be doing this program as a part of routine soccer practices, soccer games, as part of their warm up, because it is the one thing, as I said, that can prevent injuries. And it's a really great, easy resource. So make sure and check this one out. So, going through and we talked about specialization is checking in with all of your athletes about what their goals were before and now after, sports have returned. And I think one of the things I really also would love to hammer home from a prevention standpoint is that sports over specialization is one of the big things that was really killing youth sports and really getting a lot of kids injured. And so encouraging sports diversification, making sure that, hey, this is a time that kids are all able to try a lot of different sports, potentially at a level that was less competitive, since there's going to be a lot of practices, there's going to be a lot of training grounds. So trying to encourage some basketball, trying to encourage some tennis along with the soccer, maybe some swimming, some water polo, but just giving kids a chance to try a lot of different things right now, I think would be a great way that we could introduce this concept of sports diversification and get away from the sports over specialization that we were seeing before. We know that, they've done lots of work with NFL players, the dreams of getting, these big contracts is that a lot of these first round picks in any sport, if you go to Olympic sports, if you go to NCAA sports, that's the people who are successful in sports were diversified when they were young. And that's something that we really have been working on, getting data out there to show these young kids that being a diverse athlete, multi-sport athlete is going to be better for you, not only from your mental, burnout and your mental health, but also from injury prevention standpoint. So we want to encourage our kids to play different sports throughout the year. We want to encourage them to play as many sports for as long as they can and really not pick their final sport until even late in their high school years. And this is really something that we know helps prevent not only the physiologic injuries, the musculoskeletal injuries, but also the mental injuries with the burnout. This Stop Sports Injuries also is a great website where you can go to and get a lot of information, very sports specific, injury specific. So I would encourage all, athletes and coaches to go and check this one out as well. This is kind of a similar one, making sure, slide, obviously Dr. Goldman and I have had similar thoughts about this of what can we hammer home, but this is one thing that is so important, that we know that kids should not be participating in more sports, hours per week than their age. And so as he mentioned, 8-year-olds should only be participating in 8 hours a week. And that really maxes out at the 16 hours per week, is that no one should be training more than 16 hours per week. And so this is a quick, easy gauge for anybody out there taking care of kids in youth sports. Another thing that you can consider talking to someone if you've had patients who've had injuries, had surgeries, is there are a lot of different types of return to sport testing that can be done, both in medical offices and our office at OIC, but also on the private sector. And so they can actually give kids kind of a report card of where their body is. And, and this is something that can be used as kind of a baseline of what have they been doing the last 6 months and how can they improve moving forward. The return to sport testing that we do at OIC is similar to a lot of places, involves kind of 3 different parts, which is a strength testing, just how strong are their legs side to side? How is their balance doing? Are they able to actually have balance and coordination? Do they know where their toes are? And then a more dynamic muscle movement testing, which involves some hopping. And we put this information together and see how their side-by-side differences are, especially if they're recovering from an injury, recovering from a surgery. This can give us a lot of information that we then can help use to build a program to help equal out both of their sides, because we know that having balance on both sides and having equal strength and coordination on both sides is one of the things that helps prevent injuries moving forward. And then just to kind of touch on, the mental readiness, is we know that the psychological effects of COVID, everyone feels them, the frustration, the anger, the depression, the isolation. There's the mental preparedness for this, I think, is something we just really need to address and be upfront about. There's a couple different factors about that. Is what are kids' confidence even returning to sports? Are they fearful about sports? Are they fearful about contact with other people, in regards to COVID? What is their actual confidence in getting back to sports? How did they used to be as an athlete? You know, what were their performance expectations before? And then what are their performance expectations going back into this? And making sure that those are aligned and realistic is going to be really important for making sure that we're not overtraining and potentially more rapidly getting back to sports than our bodies and mental health are really ready for. Some quick questions that you can use to address with your athletes and with your kids. What is just their overall confidence, just with everything going on, just having an open conversation about how confident are they feeling getting back to these sports? How confident are they going out and giving 100%? Is that something that they feel like they can do, they're ready to do, both physically as well as mentally and psychologically? How confident are they in their skills and just their general baseline ability to kick a soccer ball, to run and dribble, to run through cones? How confident are they in just giving just their basic skills and ability? Especially for the kids who had injuries before, is how confident are they that the injury's gone away, or are they worried and concerned that that's going to come back and that they're going to have pain or a re-injury? So what's their confidence in that level? And then if they did have an injury or did have surgery or had something addressed, how confident are they in that body part? Do they feel like they've recovered 100%? Do they feel like they've gone back to their actual full level of participation? So just to kind of wrap up, so some things that I just hopefully wanted to talk about is that these injuries can be avoided. And I hope that the NFL has been an example for us for what not to do and what not, and how we can save our youth sports. Making sure that, you know, we're abiding by restrictions, obviously COVID precautions, things like that. Making sure that we're addressing not only their mental, but their physical preparation, and hopefully encouraging all of our athletes to engage in multiple sports and try different things. Use this as a time to experience new things. And then some other, you know, prevention tips is making sure that you've got up-to-date safety equipment, your conditions of your field, all those baseline things that you know of as coaches and parents, making sure that all that equipment is up to date, sized appropriately, in good condition. You know, you're going to be encouraging proper technique and going through those training schedules. That warm up and cool down, as I mentioned, that dynamic injury prevention program is a great way to just use as a great tool for the warm up and the cool down to help reduce these lower extremity injuries in particular. And making sure the kids are having fun. Obviously, that's going to be, in the end, the result is we want this to be a highlight, not something that's another thing that they have to do or causes them injuries or concerns. So here's some information of just our clinics. If you have some more information or want to reach out to us, our website down there if you've got other questions. And I think now I'd like to say thank you everyone for your participation. Sorry for my little snafu with my slides. Hopefully we got the message across, and we're happy to take some questions, I think, now that we're all done.
Thank you very much, Jen and Josh, for those presentations. They were amazing. On to questions. We got a question from Nuno Duarte Silva. This is for Dr. Goldman. In this COVID era, have you seen a rise in anxiety as something that is impacting sleep?
Absolutely. And I would tack on, even in addition to anxiety, it's the fact that our normal schedules are completely disrupted. You know, kids' school schedules are a much tighter window in the mornings. For our athletes, like their training windows are really tight typically. And so the stress and anxiousness of COVID is very pervasive in our society and makes it very hard to fall asleep because it's that quiet time at night where there's nothing distracting you from all of those anxiety-provoking thoughts. But also the fact that, you know, day and night people are working from home and students are studying from home, that physical separation of work day and then home and relaxation has been disrupted as well. So there are lots of assaults on our quality of sleep right now.
Thank you, Dr. Goldman. We'll take two more questions. The first one would be, are there any injuries or illnesses our players may be more susceptible to because of COVID?
So I think Jen pointed this out really nicely, just with that poor ramp up and missing some of that foundational musculoskeletal strength. So the core strength, the subtle strength in our ankles and hips and knees that allow for sound biomechanics. Those muscles have atrophied from some downtime. And so those poor biomechanics related injuries specifically are what we're going to see spikes of as we get back into training.
Sorry about that. Someone just joined. Josh, were you still finishing up on your answer to that
No,
question?
yeah, that was it for me. I saw Joanna just tossed a question into the chat as well. So Joanna, at UCLA, we have a mental health task force that combined some of our standardized depression and anxiety screening questionnaires with some COVID specific questionnaires that the NCAA has been using. So we've got this one form that I can send to you that we're using to screen all of our athletes. We have made that a mandated part of the physical exam for us because they all come through us for their PPEs. And we've been catching a lot of stuff, and then triaging them to our student health services, mental health services there. For you, it may be trickier because you may not be managing all the PPEs directly, right? So if that could be included as part of the mandatory PPE for a student athlete, I think that would be great. But a lot of times they're seeing their pediatrician and maybe they forgot that form. So I think in the secondary schools, finding a way to do it with maybe the team doc there, or ideally sending it out with the PPE form that the pediatrician or primary care docs are doing would be a nice time to try and catch that.
Great. Thank you very much, Josh and Jen, and to all our participants for coming. We will send you a follow-up email with both Josh and Jen's slides today, and some other resources that they have shared that could be useful to all the coaches and parents here. And thank you very much for coming. Have a great day.
Thanks, everyone.
Yeah.